Today I'm going to be discussing the rising cost of healthcare. There's many contributing factors to this, and most of those are debatable. But one of the biggest contributing factors I feel is our Medicare, Medicaid systems, and also there's some minor factors, and that includes obesity and also self-pay patients. I'm going to start with what I consider the major factors, and that's the mismanagement of our Medicare, Medicaid systems. Understanding these two government insurance companies is a really big factor. It is crucial that we know what these are and what role they play in the rising cost of our health care. According to the Harvard Political Review, Medicare is an insurance company set up for those who are 65 and over, who have retired, who are become disabled or were born disabled. And Medicaid is set up for individuals or families who low to no income. Both have a common problem of being misused because there's little to no pay to the patients. And the strain of Medicare is blamed on many things, and that includes the baby boomer generation reaching retirement age, and also the longer life expectancy that we have now than there was several years back. Medicare definitely has its own issues, but Medicaid is what I feel is the primary reason for our high healthcare cost. The Medicaid system was set up for short-term use, and most people stay on it long-term, and they don't take an incentive to help their own, they don't take responsibility for their own health care. And one of the proposed ways to get the undeserving recipients off of the Medicaid system is to do drug screening. That would be random, and that would be something that was done by the government. Senator John Albert gives us his opinion when he was quoted in the Atlantic Journal-Constitution saying, "Tax dollars should never be spent on enabling illegal activity, assuring we are giving a hand up, not just a handout." In that same article, it discusses those who oppose this bill to have the drug screening done on the recipients of the Medicaid program. They're saying that it violates the Fourth Amendment's protection against unreasonable searches. But those who are working have given up this amendment in order to have a job and be employed, because most jobs do random drug screening. And in order to have a job and to have health insurance, you do have to go through random drug screening. And I feel like it's only fair that those on Medicaid, a government program, should have to do the same. Something else that is contributing, and it's more of a minor factor, is obesity in this country. And what's concerning about that is most of the time obesity itself is not a disease, but according to the Centers for Disease Control and Prevention, obesity may cause heart disease, type 2 diabetes, high blood pressure, stroke, sleep apnea, and many other conditions. When patients have these conditions, it often leads to extra medical care because they have them, and it may even cause them to be able to apply and receive Medicare or Medicaid programs, which those are already strained. And if you're just obese and you're on these programs because you have secondary issues, then you're already adding extra strain to an overused system. But by putting stricter regulations on the Medicare and Medicaid system, and really sorting out who truly qualifies and those who are just using the system, it will cut that rising cost of healthcare, but it'll also cause some problems. And one of the biggest problems will be our self-pay patients. And when they become self-pay, they almost become non-pay. As it's stated in the Health Leaders media, hospitals write off millions in bad debt and provide charity care money for patients who can't easily find coverage. Most certainly a strain on the problem. So, along with the Medicare, Medicaid, obesity, the healthcare is rising because the doctors and facilities and everything in the medical world has to go up in order to cover these Medicaid, Medicare programs, and self-pay patients, because Medicare and Medicaid does not pay as much as a normal or regular health insurance like you would have through your work. So they're trying to overcompensate that by raising up the prices. So that raises up the prices for everyone since they're not out taking responsibility for their own health insurance. So, in conclusion, the rising cost of healthcare has many factors, many solutions, and it's going to take the responsibility of the patient to have coverage, to make payments, and it's going to take effort on the facility's part to work with the patients to help them make the payments, and it's also going to take the government taking better control of the Medicare and Medicaid and making them be more accountable as a person to qualify and to get off of it later on. As an effort, healthcare can become affordable with all these things in combination. Thank you.